So today I'm going to talk about my take on hair transplant. I underwent my hair transplant in August 2020 and today is May 2025. I'm going to complete my 5 years of hair transplant in this August. I underwent graft implantation in my front area and in my mid scalp area. I took some medicines and PRP for 6 months and post that I'm not on any medication. Of course, in this 5 years time, I've seen some hair loss and this I treat by PRP, lifestyle change and some medicines. But if you ask me that I am continuously taking some medicines after my hair transplant, the answer is no. If you happen to see my journey of hair transplant, which is a playlist itself having 10 to 11 videos and which lasts for 5 to 6 minutes, it shows everything about the hair transplant, you will come to know the answer that who should undergo hair transplant. Ideally, the person who feels that the baldness is hampering his confidence or his self-esteem should undergo hair transplant. By saying this, I don't mean that he is ideal to undergo hair transplant. There are some conservative methods, PRP, medicines, vitamin change, mesotherapy, by which we try to regrow some hair follicle as well. In Hair and Shape Clinic, we give you the cafeteria approach. That means we give you all the possible options of regrowing or maintaining your hair follicles. We will tell you the pros and cons of each and every method and the success rate of each and every method at the end of 6 months with the proven science, proven papers and our own experience. It is up to the patient or an individual to decide that what he wants as the treatment for his hair loss management. It's always a patient-centric approach and not a doctor-centric approach. If I have a patient who says, "Doc, I am needle phobic and I am also claustrophobic, but I want to do something for my hair. I am not expecting a lot of density." So for this kind of individual, the ideal treatment would be conservative management. At the same time, some people will tell me, "Doc, if I'm investing certain amount of money, I want more than 95% of the result what you can deliver to me." For this kind of individual, the hair transplant can be the better option. Your each and every need, your expectations, your logistic issues and what a doctor and clinic can deliver to you, all these factors are to be considered in planning your hair loss management journey. Thank you very much.